I'm a medical sociologist, so the research that I do is focused on understanding how social factors like where we live, work, and play are related to the mental and physical well-being of Black Americans. I grew up in the Oak Cliff community in Dallas, Texas. I'm a first generation college student, and I attended college in Houston, Texas at Rice University, where I fell in love with sociology. Sociology is the study of how our individual choices, behaviors, and life chances are influenced by our social environments, like the neighborhoods where we grew up or the country in which we were born. After I completed my bachelor's degree, I decided to pursue a master's degree and then a PhD in sociology at Indiana University. I'm grateful to have worked with the National Survey of American Life for the past 17 years. A key aspect of the research projects I lead focuses on understanding how social factors are related to the health and well-being of Black women specifically. One study allowed me to investigate questions about Black women's mental health while centering their lived experiences. I specifically focus on stress exposures such as unfair treatment or discrimination, financial stress, and negative interactions with family members. In one study, my research team and I examined financial strain, or women's worries that their total family income would not be enough to meet their expenses and bills. And I wanted to examine how financial strain was related to their psychological well being. Approximately 63% of Black women experience some financial strain or worry about paying their monthly bills and expenses. From our study, we learned that financial strain is related to increased risk for depression, as well as PTSD or post traumatic stress disorder. My research on this topic, along with other researchers who study risk factors for depression and PTSD, can help identify what harmful experiences are related to Black women's mental health and also identify ways to prevent the onset of mental disorders, as well as improve the lives of those experiencing mental health challenges. For instance, developing programs to ease financial strains and burdens can not only meet one's basic needs, but can also potentially improve mental health. When I learned that there would be a 25-year follow-up of the National Survey of American Life, I was overjoyed. Not only is this cohort a significant part of my program of research, but I also feel quite connected to this research because it is the first national study of the mental health of Black Americans. So, in many ways, I see myself as a Black American woman represented in this data collection effort. There is so much we can learn from a 25-year follow-up. For instance, we may learn about how social factors are related to the physical, mental, and brain health of Black Americans across the nation. This is incredibly important beyond research because it is our hope that this research will impact prevention and intervention programs designed to improve the health of Black Americans presently and in the future generations to come.